to thank you for coming in, and I'm really excited to share information with you. I'm just going to have to take a second here, and I totally apologize because my screen is doing things I don't want it to do. So give me 1 second. Oh boy. Okay, I'm going to have an issue here, Erin, and I totally apologize. All right, we're just going to start and we'll see how this goes because, oops, not that I don't know how to use the screen, but I have something popping up here. All right.
Yeah, is it not letting you hit play again?
It's not letting me do the slide. It came up with that pop up again, and the control panel.
Oh.
I know, it's the weirdest thing. Yes. It's not even letting me control it.
Really?
I know. Do you see that? It's really bizarre. And if I close it out, I get, I'm going to close out the webinar.
Did you push the control panel back over? Did you minimize it?
That's minimizing it. I mean, I could do it this way. The only thing is that if I do play, then it's not going to allow me to see the whole screen.
Are you talking about it's got the webinar thing coming up again?
Yes, yes.
Okay, hit the red arrow that points to the right, and it should shoot it over to the side so that you can...
Nope. Yeah, we talked about that. It won't do it.
Oh, I thought it did that.
Okay,
before though.
Fine. Okay, we got that.
Okay.
Okay, there we go. Sorry. Anyway, we're going to be talking about, it's Heart Health Month, and we'll be talking about high blood pressure and your heart. And just to give you a quick summary, the things that we will be discussing is the #1 silent killer, how does blood pressure affect your heart, and understanding blood pressure versus high blood pressure versus normal blood pressure, what steps we can take to stabilize a client's blood pressure. Us as personal trainers, that's really important. How does exercise help improve blood pressure, and developing an exercise program for your client. So when we think about heart health, people usually think about protecting the heart from coronary disease, strokes, and heart attacks. But many people don't think about the correlation between high blood pressure and a heart attack. And as a trainer, it's really important for us to understand how to stabilize a client's blood pressure and how to help them achieve a healthier heart in the long run.
All right, so we have our first poll question. Sorry, everybody, for the little bit of a technical issue we had a few minutes ago. So hopefully we are all set and we're good to go. And our first poll question is, how do you measure your blood pressure? Use a blood pressure cuff monitor, use a wrist blood pressure monitor, or you do not measure your blood pressure or your client's blood pressure. And give everybody a few moments to answer that. And while everybody is answering, I will let you know that at the end of the presentation, for joining us today, you will be emailed about an hour to 2 hours after the presentation's over, the recording from the webinar, as well as the CEC quiz. And you have until 8 a.m. on Monday, which is February 22nd, to complete that CEC quiz. If you are only calling in and not viewing the presentation, it's not going to show you as attending, so you will need to actually log into that link. So I wanted to make sure everybody knows. And let's see here. All right, it looks like everybody's answered, and we're going to share that 68% of you use a blood pressure cuff monitor, 14% use a wrist blood pressure monitor, and 19% of you do not measure blood pressure. And I am going to turn it back over to Alice.
Okay, so high blood pressure is the #1 silent killer. And the main risk factor that contributes to increased is hypertension. Now, according to American Heart Association, 1 out of 3 adults in the United States suffer from high blood pressure. And as a trainer, we need to understand the difference between normal blood pressure and high blood pressure and the impact that it has on your clients. Now, if your client has high blood pressure, this pressure puts extra strain on their heart and blood vessels. And over time, the strain will increase and their risk of a heart attack or stroke. They'll have a risk for a heart attack or a stroke if their blood pressure is not controlled. Now, other than your client advising you that they have high blood pressure, how can we determine if your client has high or normal blood pressure? And the way we do it is to measure the blood pressure by using a blood pressure monitor. So we've already taken the poll of what methods we can take to use the blood pressure to measure the blood pressure, which is a blood pressure cuff or a wrist monitor. Now, here we have a picture of a blood pressure cuff just to give you an idea, and I'm sure everybody has used this at one time or another. And with the blood pressure monitor, you get 2 readings on your blood pressure monitor. The top reading is the systolic, which tells you when the heart muscles contract, and the bottom reading tells you the diastolic, which tells you when the heart muscles are resting between beats and refilling with blood. Now, sometimes your client may come in and you may test them with to see how their blood pressure is, and they may test higher than usual. And you don't have to take that number at face value. You can give it a few minutes and then test it again just to make sure that they really don't suffer from high blood pressure if they normally don't, or if their levels are not where they're normally used to being.
All right, so we now have our next poll question, and it is going to be, which category does your blood pressure fall under? Is it in the green category, which is normal 120/80? Is it the yellow category, pre-hypertension, 120 between 139/80 and between 90? The orange category, which is hypertension stage 1, 140 to 159/90 to 99, or the red category, hypertension stage 2, 160 or higher and over 100 and plus. We'll give everybody a few moments to answer that. All right, it looks like 78% of you have voted. I'm going to give you a few more seconds to go ahead and get your answers in. All right, so it looks like 90% of you are in the green category and 10% of you are in the yellow category. So this concludes this poll question, and I'm going to go ahead and turn it back over to Alice.
Okay, so here we have a chart for the different levels of your blood pressure. So once you've taken your client's blood pressure and you determine which category they fall under, when we look at the chart, if they fall under the green category, which is normal, 120/80 or less, the blood pressure is normal and you basically have nothing to worry about. You can train your client the way you train any average healthy client. However, if they fall under the yellow, which is prehypertension, 120 to 139 to 80/89, or under the orange, which is hypertension stage 1, 140 to 159/90 to 99, or the mild orange category, which is hypertension stage 2, 160 or higher, or 100 or higher, then it is important to know how to train your client in order to, and provided that they have medical clearance. And this I stress very highly if your clients fall into any of the 3rd, The yellow, orange, or the mild orange, very, very important to get medical clearance from their doctor, because when you start training your client, we are liable for what we do with our clients. So it's really important for them to always disclose information to you. If your client falls under the deep dark red category, which is a hypertensive crisis higher than 180 or 110, this requires emergency care, and no exercise or training is recommended. So even if your client always showed normal blood pressure, but one day they come in and they show this really extreme high sign, definitely there's no training involved. You have to call medical emergency. Now, there are many factors that cause high blood pressure, such as nutrition, which is poor nutritional habits and high salt intake, lifestyle being sedentary, smoking, mainly smoking cigarettes, drinking too much alcohol, obesity, meaning being overweight, age, generally men between age 45 and older and women 55 and older, ethnic origin, African Americans and Asians have a higher risk of having high blood pressure versus Caucasians or Hispanic Americans. Family history, people who have biological family members with high blood pressure are more likely to develop hypertension themselves. That doesn't mean that if you're exercising and doing everything right that you may not get high blood pressure. I've had encounters in the past with clients and people that I know that they've done everything right, and because their family history reflects hypertension, then they also have developed hypertension. The good thing is that they're able to control it, and sometimes, unfortunately, they have to take medication. Now, if your client has high blood pressure and has been seen by their physician, they may have been prescribed medication to control their blood pressure. Sometimes medication alone does not stabilize it, or your client may decide that they want to control their blood pressure in other forms other than taking medication. So their physician recommends them to exercise. Now, just to give you some quick information here, as a trainer, I don't feel that you have to know all medications, but it's always important to know like what kind of medication your client is taking, and these are the most common 4 categories for high blood pressure medication. And one is an ACE inhibitor, and it reduces the angiotensin II in your body, and that basically is a hormone in the body that causes the blood vessels to constrict. This medication allows the blood vessels to relax and widen, and it makes it easier for the blood to flow through. And it also lowers the amount of water the body retains, which lowers their blood pressure. And you're going to notice that some of these, they're so similar. The next one is angiotensin receptor blockers, and it blocks the action of the angiotensin II in your body. This allows the blood vessels to relax and widen, making it easier for the blood flow to flow through, and it also lowers the amount of water in your body that your body retains, which lowers your blood pressure. There is calcium channel blockers, which blocks the effects of calcium in your blood vessels, and this helps your blood vessels, the walls of your blood vessels again relax and widen, and it makes it easier for the blood to flow. And the last one is thiazide diuretics. These, we all know what diuretics are. These are diuretics, and sometimes they're called water tablets. The diuretics lower the blood pressure by flushing out the salt and unwanted extra fluid from your client's body. Now, in addition to medication and exercise, there are other ways that your client may stabilize their high blood pressure. And thinking of the ways where other factors that cause high blood pressure, this is the opposite. With nutrition, eating healthier and decreasing the salt intake, limiting the alcohol intake, stop smoking, or even limit the amount of smoking. Lifestyle changes, becoming more active by exercising, and losing weight if your client is overweight or obese. One of the most important things that's recommended is when you're training somebody that's overweight and they have high blood pressure, it's always important to focus on making a lifestyle change instead of focusing on the weight loss. And one of the reasons is because there are exercises that your client may not be able to do. They have high blood pressure. So if you focus on just a lifestyle change at that point, the weight is definitely going to come off. So you have established that your client has high blood pressure, and they may be on medication and have physician's authorization to exercise. So before we decide to train the client, we have to create an exercise plan, and we need to consider certain factors before training them, because we cannot train them like we train the average healthy client. So some things to keep in mind is to take into account the blood pressure medication your client is taking, and some of these medications may cause dizziness, dehydration, abnormal elevated core temperature, or headaches while exercising. And these are just some of the side effects, not all of them. The other thing that we should consider is the type of exercises that you will have your client do, for example, resistance and or cardiovascular exercises. The frequency of the exercise activity, and we also need to consider the intensity of the exercise activity. So whether your client who has high blood pressure is taking blood pressure medication or not, we need to make sure that we do not put the client in a decline position or an upside down position, since this will cause their blood to rush to their head, and it will cause dizziness, or it may cause them to develop a headache. Another thing that's important is to pace your clients during training with rest periods. This prevents the sustained blood pressure to elevate, and it's always important to remember not to elevate the blood pressure to over 180, and that's the systolic or beyond, because they can suffer stroke or a heart attack. Other things that I didn't add here, but I also recommend with my clients with high blood pressure, which is a note that you can make, is making recommendations on the type of clothing that they wear. There are climate control clothes that they can wear that will keep the core temperature cool. Also make sure that the environment is cool for them. For example, if your client has high blood pressure, you don't want them doing hot yoga. So, or even training in any heated environment. Some clients like wearing, and I don't know if you've experienced it, but wearing the sweatsuits or the sweat waistbands, which are not recommended because that can cause its core temperature to rise also.
All right, and now we have our last poll question. There was a quick note, Alice, that some of the students are trying to take notes. They were maybe going a little fast.
Okay.
But I do want to let everybody know you're going to get a copy of the recording, so you don't necessarily have to take notes. Just sit back and enjoy the webinar, because you're going to get a copy of the recording that you can stop and take notes as you need once the presentation's over. So we definitely want everybody to, sit back and enjoy the webinar while it's happening, and then you can go back and, take notes and things like that. So here is our last poll question. What is your choice of cardiovascular activity for your client with high blood pressure? Swimming, walking, or stair climber? All right, everybody was really quick on answering this one. All right, so everybody, here we go. We have 11% like swimming, 86% like walking, and 3% choose stair climber. So at this time, I'm going to go ahead and turn it back over to Alice.
So exercise temporarily elevates the blood pressure. So when you begin your client with an exercise program, it's recommended to use cardiovascular activity. These type of activities are rhythmic and repetitive with use of large muscle groups. so such as your legs and your arms. And some of the activities that and equipment that you can use is walking, whether they're walking outside or on the treadmill indoors, or biking outdoors or on a stationary bike, rowing, which is the stationary rower, swimming, indoor, outdoors, perfectly fine, dance, whether they're working out with you or whether they're doing it on their own to be able to do some cardiovascular activity when they're not training with you. They could dance. It doesn't have to be any professional dancing or any high intense dance. It could just be some form of dancing that they're moving around or even mimicking dance moves. The elliptical machine. So these are just some ideas to name a few. When having your client do cardiovascular activities, it's recommended to do 30 minutes 5 times a week. If 30 minutes is too much for your client, you could always start them with 10 to 15 minutes at a time. You could either do 10 or 15 minutes and your session is done, or you can do bouts of 10 minutes, let them rest, and then do another 10 minutes. Basically, it's up to you, and as long as you monitor them and see their rate of perceived exertion, then you'll know if you can continue the activity or how long the waiting period is to do the next activity. Moderate breathing is recommended, 40 to 60% of your client's VO2 max. They should be able to carry a conversation while performing their physical activity without gasping for air. Again, like I mentioned, using the rate of perceived exertion is a good way to monitor your client's breathing. Moderately elevating their core temperature without having them sweat profusely. This is very, very critical because if they're sweating too much and you're raising their blood pressure too much, we've talked about that previously, they can suffer a heat stroke or a heart attack. If your client is lightly sweating and not turning red, then they're basically okay. Aside from the rate of perceived exertion, I always recommend verbalized cues with your client, asking them how they're feeling, and constantly getting that feedback from them really does help, because sometimes they may seem like they're going to collapse, but they're not. They know that they can go a little bit farther. So the rate of perceived exertion is great, but it's always good to get some feedback from them verbally. So once you've introduced cardiovascular activity to your client, and it's recommended to introduce resistance training a week or two after cardiovascular activity. And it's only because this way they get established with the cardiovascular first. We're not increasing their blood pressure too much, because with the resistance training, this is the lifting the weights, exerting them a little bit more, it will raise their blood pressure a lot higher than what cardiovascular does. Resistance training can consist of body weight, resistance bands, free weights, or weights with the machines, and these are just a few of the modalities that are listed. You could definitely use other forms of modalities, Bosu ball, physio ball, you know, there's so many other items that we can use. Start 2 to 3 times a week. Perform 8 to 10 different exercises that target all major muscle groups, and do 8 to 10 reps per exercise. Now, exercise generally reduces the systolic and the diastolic levels by 5 to 7 points. And this decrease can be done within 4 weeks, provided that your client remains on a consistent physical activity program. This includes cardiovascular and resistance. So you introduce a cardiovascular first, you add in resistance training, and then you can create a complete program for them. In addition, it is recommended that your client's blood pressure that you take your client's blood pressure periodically, not during the time that they're exercising. It's always better to take it before. If you want to take the blood pressure afterwards, always wait on at least 10-15 minutes after they've done their exercises so you can see where the blood pressure is at, but no need to take it before and after. Or another thing that you can do is have them take their blood pressure. If they only see you once a week or twice a week, ask them to take the blood pressure one of the times that they're not seeing you, so this way you know also that they're monitoring their blood pressure and they understand where their levels should be. Because a lot of times I find that when I train a client with high blood pressure, if I don't take their pressure, they don't do it. So I always recommend for them to take charge of it, because at some point you're not going to train them and they're going to need to know how to do these things on their own also. And the other reason that's recommended to take your client's blood pressure is in case they are on blood pressure medication, they can have their physician revisit their medication and see if the medication has to be adjusted, because as the blood pressure levels start stabilizing, they are going to need to get the medication adjusted, because otherwise they'll be overly medicated and they'll start having some of the symptoms that they would have with the medication side effects.
All right. That was wonderful. And as I do have a question, Alice, from Stephanie, if you are ready.
Okay.
She wanted to know, should seniors aged 82, for example, on blood pressure meds try to reach their max heart rate during cardio exercise on the treadmill or a stationary bike? Or is the max heart rate too high? Also, does blood pressure meds keep heart rate abnormally high or low during exercise?
Okay, the first question, and that's a really good question, Stephanie. How are you? Should seniors age 82 or higher with high blood pressure, do cardiovascular exercises at their max? When you're training somebody, even whether it's high blood pressure or not, they should not be trained to their max. Their training should be up to 85% of their max. Now, training a client with high blood pressure, it should be anywhere between 40 to 60% of their max. If your client has been exercising for a long time and they've had high blood pressure, it's not something new, then they could exercise at least up to 65, 75% of their max. But that's only if they've been exercising for a long time. But if it's somebody that just started exercising, I would keep it at the lowest point at 40% and then continue to graduate till you get them to 60%. And it doesn't matter which activity they're doing, whether it's the bike, whether they're walking, it doesn't matter what activity they're doing, they should still keep the level lower. With respect to the medication, sometimes the medication will keep the pressure lower, and again, because the pressure is kept lower, then you still don't want to push them to the max. I recommend using your rate of perceived exertion and see if like where they're at in terms of training, and also as you're talking to them, do a talk test. So if they're not gasping for air, then they should be able to continue with the activity. But if they're trying to have the conversation with you and they're huffing and puffing, even though their blood pressure is not showing that they're elevated, then it's important to scale back a little bit on the activity. Did I answer your question?
She hasn't typed anything else in. If you do have another question, Stephanie, go ahead and type it in the questions box. As with anybody who is in the presentation, if you have any questions in regards to the material we just covered, go ahead and type it in the questions box, and I will for sure ask the question to Alice. Mary Beth has a question. What about a woman who has recently entered menopause? Her doctor has advised that high blood pressure could be tied to being menopausal. Do you have anything on that topic?
Hi, Mary Beth. I've never and I've studied, just to take a quick step back, I studied menopause to the nth degree because I have a lot of clients that were menopausal while I was a trainer at a young age. I've never found in any studies, nor with any doctors that have specified that menopause causes high blood pressure. Um, I would say two things. The first thing is maybe go to, like, seek out another medical doctor and get a second opinion. And the other thing that I would say is maybe if you haven't asked this question yet, ask your client if they're confusing their hot flashes with high blood pressure. Now, unless they're monitoring their blood pressure and their blood pressure is elevated, the other question is, are they overweight or are they just sedentary? Because if they're overweight or sedentary, that can be the contributing factor. But if they're normal weight for their height and now going through menopause and they've been exercising, then I would definitely just look at their nutrition.
Okay, yeah, and she followed up with that her client, someone who works out regularly. It was just, something that their doctor had mentioned, that becoming maybe menopausal can at times raise your blood pressure.
I think they're confusing that with hot flashes. With what happens is the body, because the hormones are so imbalanced, we as women get these hot flashes. And if you're taking your blood pressure at that time, then it will measure higher. So if you think back in the slide, there are different contributing factors to high blood pressure. Sometimes is your environment. Sometimes, and this is just a temporary thing. It's not a permanent thing like being sedentary. This is sometimes you're wearing certain clothes that keep your body warm, and your blood pressure measures higher, or you're rushing and your blood pressure measures higher, or when they're getting the blood pressure taken, they're not sitting relaxed. Their mind is racing and thinking of a lot of different things, so of course it's elevating their stress. But I would definitely say, Mary Beth, to ask your client to just get a second opinion from another doctor. I mean, I know that some people they love their doctor, but sometimes it's always good to get a second opinion.
All right, and then there is a question. Oops, hold on. They're coming in now. There was a question wanting from Carrie, said that she's never heard that age causes high blood pressure, and she wanted to see if you could speak specifically why age would increase blood pressure.
Hi, Carrie. The reason why age increases blood pressure is because as we get older, our arteries they start thickening, so they're not as wide, and the blood doesn't flow as freely as when we're younger. And this you would definitely find in medical journals. You'll also find it in your handbook, fitness professional handbook. There are, how did I put it? There are different factors, okay, when it comes to age, and these are just general factors, only because you may know some seniors where they never have high blood pressure or they never experienced it, but you get a lot of seniors because they're active now, they won't show those signs. But if they're not active, and even sometimes when they are, it's just a natural thing that the arteries they do thicken, and it makes it difficult for the blood to flow. If you go into some of the reference pages, you'll be able to see the information.
And then Carrie followed up with a question that they thicken even if you have a very healthy lifestyle with exercise and nutrition.
Yes. I'll give you a perfect example. But this doesn't mean it's everybody. You know, it's just like somebody with family history. That doesn't mean that it's everybody that's going to end up with high blood pressure. It's just the potential. So it's the same thing where, and this is just completely off topic, as you get older, your skin gets thinner. Okay? So because your skin gets a lot thinner, a lot of seniors, they develop the excess fat in the midsection, and it's only to protect your organs. So there's a lot of different things that occur when you're older, and you can control the thickness of the fat in your midsection with diet and exercise, but you're not going to control by the time you reach 70, you're not going to have a six-pack unless you're looking to compete and continue to train and eat like if you're competing. But the general population, and this is based on the general population, where even if as an average healthy person, these things, you have the potential of these things happening.
Okay, great. And then there's a question from Travis. Let's see here. Do you check all clients' blood pressure or just the ones who are identified with high blood pressure?
Hi, Travis. I recommend before you start training a client, always check a client's blood pressure. Like the very first time you meet with them, you're doing an assessment. That would be one of the battery tests that I would recommend, only because what I've learned in the past, even if you give them a health screen questionnaire, the client doesn't always give you all the information. And if their blood pressure is controlled with medication, or if they have it controlled through other means, they may not tell you because they feel that it's under control, so therefore to them they don't have high blood pressure. So I always recommend to test their blood pressure periodically, definitely before you start training them in the very first time, and then periodically just in case. I know that I had a situation in the past, and this is why I bring it up. One of my clients, I have a very thorough health screen questionnaire, and the client did not divulge that she had high blood pressure. And that week that I started training her, and even when I tested her blood pressure, showed normal. But the week that I started training her, we did back hyperextensions, and she started getting dizzy. And my first question to her was, did you eat? She said yes. And then I asked her, do you have high blood pressure? Do you have the tendency of having high blood pressure? She said, oh, yes, I do, but I keep it under control. So it's unfortunate clients don't always tell you because they're not thinking, even when they fill out a form. So I would recommend it, and especially if they start showing signs of being lethargic or dizzy, then I would definitely test their blood pressure periodically.
Great. And Jennifer had a question. She wanted to know if the high blood pressure levels were raised. She always thought that 120/80 was normal. And is it now considered borderline high for health insurance purposes, i.e., are doctors getting, kickbacks from the insurance companies with, raising or lowering the amount of what's considered a healthy blood pressure?
And that's a really good question, Jennifer, because I've asked that question a lot. 120/80 has always been considered normal, but through the years, and I would say maybe in the past 15 years or so, the standards have changed, and sometimes you'll see 130/90, and then in other books you will see 129/89. So it just depends what you're reading, and you even see this in medical journals. It just depends like what the trend is at that moment. And to be honest with you, I mean, I work a lot in the medical field, and I really want to say that it also depends on what the pharmaceuticals are pushing at that moment. I hate to say.
All right, and then there is a question from Martha. She said, should all gyms have and I am very much going to pronounce this incorrectly, sphygnogmanometer, SPHYGMOMANOMETER? Do you know what that is?
Vaguely. Refresh me, please.
I'm not sure. She said they had one at the gym that she works at, but it was stolen, and they did not get a new one yet. And she works with special populations at the most. She said it's a specific type of blood pressure machine.
Right.
Or blood pressure cuff.
Right. No. Gyms are not required to have it. The only thing they're required to have are AED machines. I recommend as a client, I mean, as a trainer, to have your own blood pressure cuff. the fact that where you work at, you work with a special population. If you're working for the gym, I would recommend for them to replace it. If you don't work for the gym, then I would recommend for you to get something that it doesn't have to be that particular model, but something that may be similar that won't be as expensive that you could hold yourself and use for your clients. I never rely on the gym's equipment in terms of me being able to use a blood pressure cuff or a body fat tester. I don't rely on their equipment or even measuring tapes. I carry my own.
All right, and we have a question from Chantel. She wants to know, is there a specific place where a trainer can get a very detailed health screen sheet? Or if you have any recommendations of a good one.
To be honest with you, WITS in their the students workbook, there's a really good one. And if you go online, there's a lot of different health screen questionnaires that you can get. There's so many sites for trainers now. You could always ask WITS permission if you can use their health screen questionnaire. What I found in the past, though, is that using other people's questionnaire didn't work for me. So I basically created my own, and it was based on working like meeting different clients, and then I always found that I always had to add something to the questionnaire. So now my questionnaire has a lot of information that gives me the ability to have a conversation with a client, plus have on paper any situations that they may have. Like my health screen questionnaire talks about them having a physical, if they have high blood pressure or any kind of degenerative disease, any medications that they're on and the purpose of the medication, their nutrition, what type of lifestyle that they lead at this point. So just again, a lot of information that I know that's important for me to understand a client. So what I would say is just look out there. You could use WITS in the meantime and ask them if you can use it, but also look out there, see what really works for you, and think about the questions that you've had to ask your clients.
All right, and does anybody have any other questions today? We have a little bit of time left, so if you have one, let's get them in. If not, we can conclude for today. It looks like Alice has put up her information, so if you think of anything after the presentation or a topic that you would like to discuss with her, you can email her or you can email me at yvonne@witseducation.com and I can get it over to Alice for a response for you. There is a couple questions that came in. Mary Beth wants to know, have you ever heard of bananas helping with blood pressure and or with counteracting salt intake?
I've never heard, well, let me correct that. Medically, I've never heard of bananas controlling the blood pressure. I have heard maybe one or two people talk about it, but I think they had that confused with needing potassium, which is totally different from having high blood pressure or your blood pressure medication. You know, some people say, well, if I eat a banana, then it'll control my potassium, therefore I won't have high blood pressure, which is a total negative. And it's not going to control the water. The only thing that would one of the main things that would control the salt intake is not adding salt to the food, and also not eating out a lot, because when you eat out a lot, you know that there's going to be a lot of sodium in the food. It doesn't matter even if you go to a very healthy place, there's still going to be a lot of sodium in the food. The only place you cannot control that you can control it completely is at home. Does that help, Mary Beth?
I am sure. Let's see what else questions we have here. Is there a way to repair artery damage?
As far as I understand it, this is going like way beyond my expertise because I'm not a medical doctor, but as far as I understand, there is no way to control artery damage, but I mean, there's no way to repair it, but you can control it in terms of a healthier lifestyle, in terms of nutrition and exercise. So the two main things, and also controlling your weight, but the main ones would be exercise and nutrition. Because if you're eating the right foods, then you're not going to put more pressure on those arteries or even clog them.
All right, well that looks like that is all of the questions for today. So I'm going to go ahead and remind everybody that about an hour to 2 hours after the presentation, you will receive an email if you've clicked on the web link and you're actually seeing the presentation and have called in with the recording that you can start and stop. It will have the PowerPoint slide as you're seeing it. It'll be recorded just like that so that you can write things down. You might be able to even print screen on some of them if you would like. And then you'll get the 10-question quiz. You'll have until Monday at 8 a.m. to get that done. So that gives you quite a few days to, pop in and answer those 10 quick questions in order to get your CEU and CEC for attending. You must score 70% though. So I'm pretty sure you guys will all do wonderful. And at this time, I will go ahead and let Alice lead us out today.
Well, everyone, thank you for joining us for this presentation, and you had great questions. Again, I'm available if you have any questions. You can email me. I'll be more than happy to answer whatever I can, and much luck to you. Thank you for coming.
Thank you, everybody.